But an important story to track beyond that. AHPI, which is an association of hospitals, has asked 15,000 hospitals to suspend cashless treatment to Bajaj Allianz. Now, what does this mean, not just for the company, but everybody that's holding those policies? Pallavi is joining in to tell you more about this. Pallavi?
Yes, right, Alex. So the Association of Healthcare Providers, which essentially represents roughly about 15,000 hospitals and healthcare institutions across the country, has advised its member hospitals to stop providing cashless treatment services for policyholders of Bajaj Allianz General Insurance. And this is set to come into effect from September 1st. Now, the advisory essentially follows complaints which the AHPI says it has received from member hospitals regarding Bajaj Allianz's refusal to revise hospital reimbursement rates. Now, the AHPI has also said that they are likely to meet representatives from Bajaj Allianz on Thursday to discuss the suspension of these cashless services. Members of the core committee of the AHPI are likely to meet representatives from the company, and assuming the talks go well, we could see a withdrawal of this advisory. Also, the AHPI is also in talks with Care Health Insurance, and they're also likely to meet Care Health Insurance soon regarding the same issue.
All right, let's hear from the association itself. We've got Dr. Giridhar Gyani, who is joining us, Director General of the Association of Healthcare Providers India. Doctor, thanks so much for taking the time. Hopefully we've set this up, but can you take us through what the key issues are? It has to do with settlement of dues. Is that the primary issue?
Okay, just in a half a minute, let me tell you the data. The health insurance in India today is around 1.3 lakhs crores in gross premium. Now, basically, it is on the principle of risk pooling mechanism. That is where we say many pay a little so that few do not have to pay a lot. Now, what we have noticed in the recent years, that the medical loss ratio, or sometimes we call it incurred claim ratio, is actually going out of the limits. Now, this ratio basically is about how much a premium is collected and how much actually it is used for the paying the medical claims. So, Germany, for example, France, for example, the administration and sales related expenditure by the insurance companies is roughly 10%. In India, surprisingly, it is going over 40%, while IRDA also allows below 30%. This is one of the aspects I wanted to bring to your notice, that insurance companies have to, I think, relook at their way of working so that the administrative cost comes down so that the remaining money can be actually utilized for the claims. That is one aspect. Now, coming to this issue of the Bajaj Allianz, our number of hospitals have been raising the concern, mainly, if you ask me, pre-authorization issues, which is very, very important when the patient is admitted. The frequent rejection is done without inappropriate reasons. Actually, that really causes a lot of problems for us as well as for the patient. Then we get arbitrary deductions. And then again, there is a lot of dialogue going on, and the patient, is waiting for the discharge.
Yes.
And one more aspect, let me tell you, we have agreement with them normally, and this agreement is rates are fixed there.
Yes.
Over and above, they keep on asking discount, and the tariff revision is not happening for 3 years, whereas the inflation, medical inflation in India, I think you are well aware,
5 to 7%.
It is around 8 to 9%.
Yeah.
So
right.
These are the issues. We thought, let us, give them the notice. We gave them the notice. Unfortunately, they could not reply, and then we had to issue the notice for the, suspension.
Sure. Yeah.
Hopefully, I am still hopefully that when they come to the table, they accept. They, in fact, nice of them. They have accepted to come over to Delhi and we will put them across with our Chief Financial Officer.
And we look forward to hearing the update from there. But Dr. Gyani, very quickly, I do want to ask you something about what you mentioned at the start. You said that, and we do know that premia have gone up very substantially, and you would be aware of this. Would you say that ultimately what you're saying is that the increase in premium is not translating into the settlement of medical dues? So a large part of the increase in premium is going to the insurance company themselves. Is that fair to say?
Yeah, administration and sales related aspect, which they have to cut down.
Okay, fair enough. Thank you so much, Dr. Gyani, for joining us today, and wish you all the best to settle this issue that you have come up with. All right.